Good morning, everyone, and thank you so much for joining us this morning. I'm Shannon Johnson, and I'm here with my partners, John Veering and John Fuchs, and we are going to be talking with you today about tackling key business issues, particularly employment and stimulus issues during this COVID-19 pandemic. We have a lot of ground to cover today, and so bear with us as we go. We have a pretty big agenda. We're going to talk specifically about the Families First Coronavirus Response Act, or the FFCRA. I'm going to give you a quick update on shelter-in-place orders, local shelter-in-place orders. We got a lot of new news in the last couple of days. We're going to talk briefly about some unemployment benefits issues, OSHA guidance on safe workplaces, steps when your employees are diagnosed or exposed. John Veering is going to handle some answers to frequently asked questions. John Fuchs is also going to talk to you about stimulus programs under the CARES Act and the FFCRA. And we've got a helpful page of resources for you as well at the end, so you can click those links and go to various web pages because there's so much information out there. We can't possibly cover it all for you today. Now, once we're done with the presentation, which we're planning on talking to you for about an hour, if you have time, we do have about 30 minutes set aside afterwards for Q&A for those of you who do have time to join us. And there's a way for you to submit your questions in advance if you'd like to. There should be a Q&A button on your Zoom screen. And so as we're going through, if you think of a question you'd like us to answer at the end of the presentation, feel free to type that into your Q&A box, and we'll take all of those questions together at the end so that we can move through our topics quickly today. Just a reminder, everything we're talking about today is really rapidly changing. I would say on a daily basis, but honestly, it's almost like an hourly basis. And so because of that, what we're saying is right now, but this could change tomorrow. So make sure you're staying up to date on what the latest orders are, what the latest law is, what the latest guidance is. Feel free to reach out to us anytime in the future with questions as things continue to evolve and change with this situation. And with that said, we'll get started. The first thing we're going to talk about is the FFCRA and some related guidance from the DOL. And these provisions apply from April 1 through December 31 of this year. Just in general, the FFCRA provides that covered employees provide up to 2 weeks of paid sick leave. So 2 weeks up to 80 hours of paid sick leave at the employee's regular rate of pay if the employee is unable to work because the employee is quarantined and or experiencing COVID-19 symptoms and seeking a medical diagnosis, or 2 weeks or up to 80 hours of paid sick leave at 2/3 of the employee's regular rate of pay if that employee is unable to work because of a bona fide need to care for an individual subject to quarantine or care for a child under 18 years of age whose school or child care provider is closed or unavailable for reasons related to COVID-19, and or the employee is experiencing a substantially similar condition as defined by the Secretary of Health and Human Services in consultation with the Secretaries of Treasury and Labor. In addition to that, a covered employer must provide FFCRA leave to employees that it has employed for at least 30 days, up to an additional 10 weeks of paid expanded family and medical leave at 2/3 of the employee's regular rate of pay if the employee is unable to work due to a bona fide need for leave to care for a child whose school or child care provider is closed or unavailable, to the extent that is for reasons related to COVID-19 in particular. Now, there are certain qualified reasons for leave. I've got the 6 reasons up on the screen for you right now. And the paid sick time is if the employee is unable to work or unable to telework due to a need for leave because the employee is subject to a quarantine or isolation order related to COVID-19, has been advised by a healthcare provider to self-quarantine, is experiencing COVID-19 symptoms and seeking a diagnosis, is caring for an individual subject to one of the orders described in 1 or 2, is caring for a child whose school or place of childcare is closed for reasons related to COVID-19, or is experiencing one of the substantially similar conditions that we talked about. Now, the duration of the leave varies depending on which one of these situations applies. So for reasons 1 through 4 and 6 on the screen, a full-time employee is eligible for up to 80 hours of leave, and a part-time employee is eligible for the number of hours of leave that the employee works on average over a 2-week period. And if it's reason 5, they're eligible for up to 12 weeks of leave at a 40-hour week if they're full-time, and a part-time employee is eligible for leave for the number of hours that employee is normally scheduled to work over that period. To calculate the pay, the applicable rate of pay is the highest applicable wage rate, either their employee's regular rate of pay, FLSA minimum wage, or the highest applicable state or municipal minimum wage. So if the leave is for reasons 1, 2, or 3, employees taking leave shall be paid at either their regular rate or the applicable minimum wage, whichever is higher, up to $511 per day and $5,110 in the aggregate over a 2-week period. If it is for reasons 4 or 6, employees taking leave shall be paid at 2/3 of their regular rate or 2/3 of applicable minimum wage, whichever is higher, up to $200 per day and $2,000 in the aggregate over a 2-week period. And for reason 5, 2/3 of their regular pay or 2/3 of the applicable minimum wage, whichever is higher, up to $200 per day and $10,000 in the aggregate. Now, the first 2 weeks are unpaid, but an employee can use their paid sick leave or accrued paid time off under their benefits package if available, if they so choose. Covered employers, the paid sick leave and expanded family and medical leave provisions apply to certain public employers and private employers with fewer than 500 employees. Now, small businesses with less than 50 employees can qualify for an exemption if the leave requirements are going to jeopardize the viability of your business as a going concern. So in the final rule that was issued on April 6th, the DOL spent a lot of time discussing this in more detail, what exactly it means to claim this exemption as a small employer. And they basically explained that you're exempt from the requirement to provide leave when the leave would cause your small employer's expenses and financial obligations to exceed available business revenue and cause the small employer to cease operating at a minimal capacity. 2, the absence of the employee or employees requesting the leave would pose a substantial risk to the financial health or operational capacity of the employer because of specialized skills, knowledge of the business or responsibilities. Or 3, the small employer can't find enough other workers who are able, willing, and qualified and will be available at the time and place needed to perform labor or services that the employer or employees requesting leave would normally provide. And these labor or services are needed for the small employer to operate at a minimal capacity. So only for these specific reasons can an employer deny paid sick leave or expanded family and medical leave. Now, the employer is supposed to maintain material and documentation. You are not to send materials to the Department of Labor explaining why you need this exemption. You need to keep your paperwork showing why you're entitled to the exemption, but you don't actually need to send anything into the DOL, and they're very clear on that. Now, if you have not already posted an employer notice on employees' rights under the FFCRA, you need to do so immediately. Every covered employer has to post in a conspicuous place on your premises a notice of the FFCRA requirements. And there is a model notice out on the DOL's website. We've got a link to the DOL website on our last slide for you. You can post that model notice, and generally, you should also email that notice or direct mail, post it on your company intranet to the extent you've got employees working remotely. Now, if you're a healthcare provider or emergency responder who is excluding some or all employees from benefits under the FFCRA, you would need to consider differently how to communicate this exclusion to employees. Now we're going to talk a little bit about our local and our state and local orders. And I'm going to assume that everyone knows about sort of the initial orders. And so really we're going to focus on the updates that have come up just in the last couple of days. So Kansas City, Missouri, Mayor Lucas was one of the first ones to put a local shelter-in-place order in place. It went into effect on March 24th and was originally scheduled to expire on April 24th. But yesterday, this was extended for Kansas City, Missouri to May 15th. And Dr. Rex Archer, who is the director of the KCMO Health Department, yesterday stated that even if people follow stay-at-home orders and social distancing guidelines, more periods of closure may be needed over the next 2 years. So we do expect that this could be extended, it could be modified over time. We're not exactly sure where this will go, but at this point, it ends on May 15th. North Kansas City, Missouri's Mayor, Don Stilo, I'm probably pronouncing that incorrectly, also extended the stay-at-home orders for North Kansas City yesterday through May 15th, following Mayor Lucas's extension. And it's my understanding that late in the day yesterday, some other cities on the Missouri side did the same. For example, Lee Summit late in the day yesterday also announced through May 15th. Now, keep in mind that while the current versions of these orders still allow continuation of certain businesses considered essential to keep going, they are subject to change, and so changes may continue to be made as the COVID-19 situation evolves. So you should be staying up to date on what the orders say. And we do have the orders posted on our own website, sb-kc.com/COVID-19. The link to that is at the end of this presentation as well. Now, Kansas has a statewide stay-at-home order. Originally was supposed to expire in just a couple of days on April 19th. On April 15th, this was extended via an order to midnight on May 3rd. And so right now, that's the end date for the state of Kansas. Now, Governor Kelly said that because confirmed cases are continuing to increase in Kansas, and internal and external modeling are predicting a peak somewhere between April 19th and 29th. We're not exactly sure that May 3rd will be the end of the stay-at-home order, but that is where we're sitting right now. She did say that the governor said, or she did say that the earliest Kansas schools would reopen would be in August, and that when she does start opening the state back up, it may be in stages. Certain areas may open up before others, and I think we can probably assume metropolitan areas will be the longest time before we're released from orders in general. Now, the Johnson County Board of Commissioners did discuss this decision by Governor Kelly yesterday at their meeting, but as far as I know, they have not actually taken any action to extend the Johnson County local order beyond the May 3rd date. That could still happen, but as of yesterday's meeting, that decision had not been made as far as I have seen. Now, the guidance from Kansas cautions that just because a business may fall into a category of being essential, it doesn't mean that the business should still be open. The governor has strongly encouraged that unless you absolutely need to be open to fulfill one of the essential functions, you should strongly consider not exposing employees or the public to the dangers associated with COVID-19. In other words, the governor is saying, if your employees can work from home, allow them to, even if you're essential. Obviously, that's not a strict mandate if your business is considered essential. And some businesses, you can't send everybody home. It's not possible for everyone to telework. So you have to take it with on a situation by situation basis. Now, Missouri also has now extended their stay-at-home order through May 3rd, similar to what Kansas did just yesterday. That was announced. The governor basically said he's taking measures to make reopening the state his highest priority. And those priorities right now are protecting healthcare workers, first responders, and direct care workers, strategically opening businesses, presumably over time and with limits as those businesses are reopened, expanding testing, expanding availability and reserves of personal protective equipment, and monitoring Missouri-specific data for potential outbreaks. The Missouri order does allow for more strict local orders, such as the one that's in effect in Kansas City, Missouri, that stretches out till May 15th versus May 3rd. And the statewide order does contain restrictive limits on the number of people allowed inside any open business. These limits are 25% of a building's authorized occupancy for retail locations of less than 10,000 square feet, 10% or less of the building's authorized occupancy of buildings more than 10,000 square feet, and the occupancy requirement is intended to limit crowds and lines inside stores. If you've been to Costco lately, you'll see how businesses are implementing this and helping people, stay 6 feet apart, only allowing so many people in the store at a time, etc. Now, briefly, we're going to talk about unemployment benefits available in Missouri and Kansas. The federal pandemic unemployment compensation program, those payments began just this week, and anybody who's eligible for regular state unemployment benefits is going to receive an additional $600 per week as a federal supplement. These payments are going to end the week of July 25th. In Missouri, their regular unemployment insurance program continues to be in effect. And one commonly asked question is, can an employee quit their job to collect unemployment and get this $600 weekly federal payment? Some people are worried that it'll cause employees to want to leave because the federal incentive is so good. Under Missouri unemployment law, most people who are currently employed and quit are not eligible for unemployment benefits. If an employer offers sick leave or other leave or remote work options to address COVID-19 in lieu of layoffs, then a person who quits on their own volition does not qualify for unemployment benefits. And at this point, there's no federal legislation that would change this part of Missouri's program eligibility. Now, if an employee is off work due to COVID-19 but still receiving pay, sick leave, vacation pay, PTO, whatever your benefits might be, the employee is generally not eligible to receive unemployment benefits unless they're receiving less than $384 per week. However, if an employer temporarily shuts down operations due to COVID-19, employees will likely be eligible to apply for benefits so long as they meet remaining eligibility requirements. And actually, Missouri has a pretty helpful Q&A section on their website. If you go there, a lot of unemployment questions are answered for you there. They're trying to put a lot of guidance out there so that just because this is so new and so rapidly evolving and there's so many people, unfortunately, filing for unemployment right now. Now, where a business has to require an employee to quarantine because of suspicion of COVID-19, it is likely the employee is going to be eligible for benefits in Missouri. If the employee voluntarily elects to self-quarantine for COVID-19, they may be eligible for unemployment benefits, but it depends on the context. If the employee does have the option of teleworking and they accept it, then they remain employed and they're not eligible for benefits because they're still employed. But if there's no telework option available or offered, then they may be eligible for benefits. And likewise, an employee who leaves work to care for children due to school closures might not be eligible for benefits if they're electing not to work, but the Missouri DOL has made clear on the website that that's really a factual circumstance. So it's the facts and circumstance of each situation that's going to determine whether that employee is entitled to benefits. Now, in Kansas, a lot of Kansans are having difficulty filing for unemployment because Kansas's system, unfortunately, is outdated and the technology is just overloaded right now. So just yesterday, the KDOL asked that people with last names beginning with A through M file their claims on Sunday afternoons, Tuesdays, or Thursdays. People with last names beginning N through Z should file claims on Monday, Wednesdays, and Fridays. And Saturdays are going to be reserved for people who were previously unable to file their weekly claim. There's just been a lot of problems. Even trying to get on their website right now is really difficult. So I think you kind of have to bear with them at this point. Similar to Missouri, If an employee is receiving paid leave of some sort, PTO, vacation leave, or some other paid benefit that the business already provides, the employee is considered employed for purposes of unemployment and not entitled to benefits. But if the employee isn't working or being paid despite being available for work, they likely are entitled to benefits. And they're not required to look for other work if they're unemployed due to COVID-19 and have taken all their necessary steps to return to work. I should note too, and I neglected to mention this when we were talking about Missouri, but in both Kansas and Missouri, the waiting week has been waived. Now, an employee whose employer has temporarily shut down to COVID-19 may be eligible for benefits if they're not working and not earning money, but the employee's claim must be evaluated by KDOL before it's going to determine an employee's eligibility in this situation. And the KDOL, basically on their website, they're encouraging everyone, go ahead and submit. Let us look at what you've got. Let us look at your particular situation, and we'll tell you whether or not you're entitled to benefits. They're encouraging everyone to apply. So if an employee's hours has to be cut due to COVID-19, they may be eligible for benefits based on the criteria on the screen here, the basis for the reduction, their weekly earnings, and whether they're physically able and available for work every week. Real quickly, I want to talk to you about our OSHA guidance on providing a safe workplace. OSHA has these 6 guidelines basically for basic steps for reducing the risk of worker exposure to COVID-19. And these steps are to develop an infectious disease response plan if you don't already have one, implement basic prevention measures, develop procedures for prompt identification and isolation of your sick workers, develop and implement flexibility where possible, develop workplace controls, and follow existing OSHA standards. On developing your response plan, if you don't already have one, it's really not too late to put one in place. In fact, given what the mayor during the press conference said yesterday about this potentially going on off and on for 2 years, this is something that you need to look at over time, how your business is going to continue operating and what you can do to respond and be flexible as time goes on. So stay abreast of guidance from our federal, state, local health agencies and consider how you're going to incorporate those recommendations and resources into your workplace specific plans. You really need to assess the level of risk that your particular business or office has. You might consider increased rates of worker absenteeism, the need for social distancing, potentially staggering work shifts if you're in a manufacturing plant, for example, and can do something like that, downsizing operations, and even simple things like considering whether or not there are going to be interrupted supply chains for your business or delayed deliveries, etc. On implementing basic infection prevention measures, basically OSHA just wants you to help encourage your employees to implement good hygiene and infection control policies, promote thorough hand washing and frequent hand washing, provide hand sanitizer in your office if you can find any, encourage your workers to stay home if they're sick. Encourage your employees not to share workspaces and not to share tools and equipment if that's possible. Make sure if they are having to share tools and equipment that they are doing appropriate things to sanitize in between. Allow flexibility for telecommuting where that's possible and feasible for your business, and maintain regular housekeeping practices, including routine cleaning and disinfecting of surfaces, equipment, your kitchen areas, your bathroom areas, etc., in your offices. Develop policies and procedures for prompt identification and isolation of sick employees. And John Fuchs is going to talk a little bit more about this later, so I won't go into great detail on that, but you need to make sure you're monitoring whether or not you have any sick employees in the office and encourage sick employees to stay home. Develop, implement, and communicate workplace flexibility. Telecommuting where possible right now is recommended. Implement some workplace controls. Basically, OSHA says the best way to control a hazard is to systematically remove it from your workplace rather than relying on your workers to reduce their own exposure. and follow existing OSHA standards. There's not specific standards, but one of the most relevant probably is the PPE, or personal protective equipment standards, which require using gloves, eye and face protection, respiratory protection. If that applies to your business, make sure you're continuing to follow that guidance. Now, one last thing on OSHA, because this is a little bit newer. Originally, OSHA had said COVID-19 can be a recordable illness if a worker is infected as a result of performing their work-related duties. And you're only responsible for recording cases if all of these criteria are met. So you've got a confirmed case of COVID-19. The case is work-related as defined by the reg, and the case involves one or more of the general recording criteria. For example, there are days away from work, medical treatment that goes beyond first aid, etc. Now, there was a lot of pushback, especially amongst the construction industry, but others I'm sure as well, on this and the recordability of the COVID-19. I think it's really difficult to say for sure if they're infected as a result of performing their duties. And so on April 10th, OSHA clarified that it's not going to be enforcing its record-keeping requirements except in certain circumstances. And so what OSHA said is, until further notice, they're not going to enforce 29 CFR 1904 to require other employers to make the same work-relatedness determinations except where there is objective evidence that a COVID-19 case might be work-related. For example, the example they gave is a number of cases developing among workers who work closely together without any alternative explanation. And then the evidence was reasonably available to the employer. So, if the employer learns information regarding its employees' health and safety in the ordinary course of managing its business and employees. So there is, if you click the link, there is a lengthy memo on this enforcement guidance and the recordability, and I'd encourage you to read that for more information if you have concerns about this and need to know if your specific circumstance might qualify. Now I am going to turn this over to John Veering to talk to you a little bit more about what to do when an employee tests positive or is exposed to COVID-19.
Thanks, Shannon. I might say as an introductory comment that our presentation today is trying to deal with general statements. We have a lot to cover, but there are exceptions, and we do encourage you, if you have specific questions with respect to specific legal matters, to call us directly. This is recorded, and there's no attorney-client privilege if everybody hears your question and answer. And there are exceptions to some of these rules. That having been said, what do you do when an employee either tests positive for COVID-19 or tells you he or she has been exposed? Next slide. If the employee is at work, send them home immediately. If you have a mask, give them a mask to wear to prevent spread of the virus. If they're at home, tell them not to report to work, isolate at home, maintain contact with the employee by phone or email as opposed to having the employee come in. If they've only been exposed and there's no positive test result, find out the details of the exposure. Is this somebody whose wife works on a COVID-19 ward at a hospital, and there's a great likelihood that the husband has contracted the virus from her? Or is it a more remote instance of exposure, such as I was talking to my neighbor across the fence, he handed me a beer, I found out a week later he has the virus. Maybe, when I touched the can of beer, some virus is exposed to me and I forgot to wash my hands. Two very different situations. If you have a positive test result, that's a different situation. Find out from the employee, if possible, who he or she had contact with at work. Explore work from home options. There may be some very limited cases, if it's a critical employee and it's the type of exposure I mentioned about, they both touch the same beer can, that you might consider if they could work in isolation, wear a mask, do temperature testing, have sufficient social distancing. But remember, asymptomatic people can spread the disease. So if the person has been exposed, and certainly if they have a positive test result, the safest course of action is to keep them out of the workforce. Next. The CDC had issued for some period of time guidance that said, hey, if you've been exposed or test positive, self-quarantine for 14 days. And that's assuming you don't have to go to the hospital or seek more care. On April 4, CDC revised its guidance. And this guidance on the next couple of slides deal with people who have had a positive COVID-19 test and they have symptoms. Under the new guidance, if the person has not been able to get follow-up tests, they can end isolation after at least 3 days with no fever, without use of fever-reducing medicines. There's been an improvement in respiratory symptoms, and at least 7 days have passed since the symptoms first appeared. Next slide. The next slide deals with the situation where someone tests positive for COVID-19, but they've been able to obtain 2 negative follow-up tests more than 24 hours apart. In those instances, CDC says that if the person has no fever, without the use of fever-reducing medicines, and improvement in respiratory symptoms, they can end self-isolation and come back to work. Next slide. What about the person who tests positive for COVID-19, has no symptoms? Again, prior guidance was 14 days self-quarantine. The new guidance is, and this is assuming the person doesn't have negative follow-up tests, that at least 7 days have passed since the date of their first COVID-19 diagnostic test, no subsequent illness or symptoms, then they can discontinue isolation if for 3 days following discontinuation, they stay at least 6 feet away from others and wear a mask. Next slide. Okay, before I get into notifying coworkers, I'm going to address the CDC footnotes about when you can come back to work. And in those footnotes, CDC indicates that it continues to recommend 14 days of quarantine if someone tells you they've been exposed to the virus. And that, ironically, is less time than someone who is known to be infected with a positive test. So this sounds like it doesn't make much sense on its surface. The CDC says that people who actually have the disease are less likely to be shedding the virus at that point. But the CDC recognizes that employers may choose to apply more stringent criteria than these new April 4 criteria. The CDC also recognizes that if you have, for example, a healthcare worker who's going to be in the workforce, working around people who are very vulnerable, then a longer period would be appropriate, and also recognizes people working in critical infrastructure without explaining exactly what that meant. It may need a longer time period. A longer time period might be warranted by the employer, and notes that persons who have conditions that weaken their immune system may have prolonged viral shedding of the virus after recovery. So I would suggest that you consider, if you want to be safe, relying on the old 14-day initial guidelines put out by the CDC. Last night I watched the president's press conference and looked at the guidelines for opening up America. And I do not have a slide on that, but the guidelines for all phases for employers include developing and implementing appropriate policies in accordance with federal, state, and local regulations and guidance, and informed by industry best practice regarding social distancing and protective equipment, temperature checks, testing, isolating and contact tracing, sanitation, use and disinfection of common and high traffic areas, business travel, monitoring the workforce for symptoms, not allowing symptomatic people to physically return to work until cleared by a medical professional, develop and implement policies and procedures for workforce contact tracing following employee COVID test that's a positive. So my recommendation is that you do come up with a plan, just as Shannon indicated. At some point, hopefully, there'll be sufficient testing that you can have someone do 2 negative tests before they come back to work. You could consider temperature checking people when they come in, but again, bear in mind that people can be asymptomatic and spread the virus. With respect to notifying coworkers, you have a duty to maintain a safe workplace. And so if you find out that an employee has been exposed or has tested positive, then bearing in mind that the EEOC and the Missouri Commission says you have to keep the name of the person confidential, you need to take steps to notify co-workers, which could include saying so-and-so who worked in this department has tested positive or been exposed, or working in this area of the plant, or working on this machine. People may be able to guess who it is, but you have a balancing act here. And the other thing I would recommend you consider is talk to the person who tests positive or is exposed. They may well give you permission to let the coworkers know. And if so, you don't have to worry about the confidentiality if you have that permission. Next slide. Persons at higher risk, 65 and older, chronic lung disease, serious health condition, immunocompromised, severely obese, diabetes, kidney disease, liver disease, HIV. These are the most vulnerable workers that you're going to have. And so I wouldn't recommend you say to your employees, well, anybody over 65 can't come to work, because that would be age discrimination. But if an employee is in one of these categories, is requesting a leave or requesting not to come to work, that needs to be handled on a case-by-case basis. Next slide. Answers to frequently asked questions. These are general questions, and so I'm going to go through them quickly because we've got a lot of material to cover. Give me the first one. How does a business calculate the amounts due for paid leave? And I see we've had a couple of questions already on this subject. The Family First Coronavirus Response Act has some questions and answers. They're fairly detailed. I think they're up to 70 or so now. We have a link to that. Numbers 5 to 9 explain in detail how to make those calculations. We don't really have time to cover it, but look at that guidance. It is very detailed about how you do those calculations. Next slide. Can paid leave or expanded FMLA leave be taken intermittently while teleworking? The answer is yes, if the employer and employee agree, if the person is working from home. If you're not working from home, paid leave must be taken in full day increments. Look at Q&A 20 to 22 in the Family First Act. Next slide. Must a business continue employees' group health benefits while employees receive paid leave? The answer is generally yes. See Q&A number 30. Now, one thing to think about, because many employers are having to lay off employees, is that if you lay off your employees or reduce their hours, you need to check with your insurance broker, look at your summary plan description, talk to your insurance carrier to see whether these people can maintain group health and benefits, and if so, on what conditions, because that's obviously critical for many employees. Next slide. Do employees have reemployment rights if they are taking paid sick leave or expanded FMLA? Generally, yes. However, if you have let's just say your business is down and now you have to lay off 50% of your employees, if that employee would otherwise have been laid off, even if they continue to work, then you do not have to reemploy that individual. but it is your burden as an employer to be able to justify that, so you need some documentation. See question and answer number 43 for more details. Next slide. When can employees receive paid sick leave for a federal, state, or local quarantine or isolation order related to COVID-19? Generally, if you can't work or telework, even though your employer has work for you, you would be entitled to benefits. You can't take paid sick leave for this reason if your employer, for example, if you're a business that's not an essential business, and so there's no work for you, for the employee, then you don't get paid leave, you apply for unemployment. So see Q&A number 60. Next slide. If an employee becomes ill with COVID-19 symptoms and they say, guys, I don't want to bother my doctor because I know he's busy, I'll just stay home for 2 weeks and then I'll come back. Are they entitled to be paid for those 2 weeks? Generally, no. That's addressed in Q&A number 62. Normally, you only get paid leave if you're quarantined because it's on advice of a healthcare provider, or it's during the time when you have symptoms and you're seeking a medical diagnosis, and then only if you can't work from home. Next slide. Can businesses reduce the salaries of exempt employees? If it's an hourly non-exempt employee, you only have to pay them for the hours that they work. However, as a general rule, if you reduce the salary of an exempt employee, it causes a loss of the exemption. And that's based on the principle that an exempt employee is entitled to their full salary if they do any work during a week. Now, you can make up that salary with PTO and even allow a negative PTO balance. But if you want to reduce the actual salary of the employee because there's just not enough work for that exempt employee, then the only real option is making a prospective reduction in pay for the salaried exempt employee that is not related to the quantity or quality of the work, as long as they continue to receive $684 per week, which is a salary minimum. And by that, I mean you can't treat your exempt employees just like an hourly employee and say, okay, well, this week we're going to do have your salary at a certain level, and next week it's going to be a different level. You need to do this on a going forward basis. It can't be day to day, week to week, or over a short time period. Some people say it needs to be at least a month. Others say 3 months. And if you reduce, you can just tell everybody, look, there's a lack of work, times are tough, we're going to reduce your pay 20% or 30%, and you'll just work whatever hours are necessary. Another option is to convert all of your exempt people to hourly. And you can't do this on a week-by-week basis either and then convert them back. But you might decide, I'm just going to treat everybody as hourly because 1 week I may need them to work 50 hours. The next week I may need them to work 20 hours. DOL fact sheet number 70 in the materials provides more detail on this. Next slide. What are the requirements for work share in state of Missouri? Kansas is similar, but I'll go through Missouri. You have an affected unit of 3 or more employees. The normal work hours are reduced somewhere between 20 and 40%. The plan applies to at least 10% of employees in the affected unit. The employer certifies that fringe benefits remain the same or to the same extent as other employees not on the shared work program. The employer certifies that the shared work plan and reduction in hours is in lieu of a layoff that would affect at least 10% of the employees in the affected unit. Again, this is the affected unit, not the whole company, and would result in an equivalent reduction in hours. The employer has to have submitted their quarterly contribution and wage reports, and the employer must get the plan approved by the state of Missouri in advance and submit weekly work share certification. Next slide. Why is this work share program advantageous? Well, let me give you an example. You have an employee who works $15 an hour. You reduce their hours from 40 to 32. So their wages are $480 a week. Unemployment is zero because the person is making more than the allowed maximum of $384 a week. So they end up with $480 for the week. If they're on work share, same reduction in hours, so they get $480 in wages from you, plus they get 20% of the unemployment, which is $64, which isn't too much, except they also get the $600 federal unemployment subsidy. So their total wages plus unemployment for the week are $1,144, which is substantially more than they would get if they were not on a work share plan. Next slide. How do you know if you have under 500 employees so that you're subject to this Family First Coronavirus Response Act? Well, when you count full and part-time employees, employees on leave, temporary employees who are jointly employed by you and another employer, such as the temp employees that are working for you, day laborers. Now, there are two complicated issues that you need to think about. When one corporation has an ownership interest in another corporation, the two corporations are separate employers unless they're joint employers. And we've cited to the recent Department of Labor regulations on who's a joint employer, but it looks at, hiring, who hires and fires the employees, who supervises and controls their work schedule, who determines the rate and method of payment, and maintains the records. Then there's another category where two companies that are separate employers can be considered an integrated employer. And so you count both under the integrated employer test, and we have the regulation down there. But it looks at 4 factors: common management, interrelation between operations, centralized control of labor relations, and degree of common ownership and financial control. A couple of other quick items before I turn it over to John Fuchs. We don't have time to talk about the WARN Act. We don't have time to talk about all the factors that need to be considered when you're doing a reduction in force, so you don't, for example, let go 50% of your, 25% of your employees, but that turns out to be 75% of your minority employees. Also, one last item, my partner Brenda Hamilton and I have developed a form that's attached that you can use as a leave form when an employee asks for paid leave or expanded FMLA leave, that gives the reasons because there's no government form, and provides documentation you can use for tax keeping records. That said, I'm passing it over to John Fuchs.
Thank you, John. And just as a follow-up on that, these slides, we're going to post these on our website so that you can go click on all the individual links, and that form that John just referenced is up as of, I think, 5 minutes before this webinar. So you can go access that on our site now, and then the slides with all the other links will be available shortly after the webinar. So I'm going to try to give you a quick overview of some of the stimulus programs that are available under both the CARES Act and the FFCRA to help you pay for some of the issues you're likely facing at the moment. The most popular one, the one we've gotten the most questions on, is the Paycheck Protection Program, the PPP. We've also had a number of clients looking into the Economic Injury Disaster Loans, or EIDL loans. I'm going to focus on those two primarily here. There are a few other ones that I'll touch on briefly, but for the most part, the first two have been the most beneficial for people, as you'll see as we work through these. We can go to the next one. So for the PPP program, I'm imagining quite a few of you have heard about it. I'm going to give a real quick overview here of the maximum loan you can get is $10 million, or if lower, 2.5 times your average monthly payroll costs from the year prior. The SBA has clarified that you can either use calendar year 2019 or the 12 months prior to your application. They appear to accept both, but we've seen differences on different banks on that. There's certain limitations on high earner compensation. Once you figure out what your amount is, then you have to use that loan proceeds for specific amounts of specific expenses: group health benefits, certain utilities, mortgage interest, rent payments, and then payroll expenses. There's a lot of confusion related to the $100,000 payroll expense limitation. The way we understand it at this point is that you can include those wages up to $100,000, as well as, in most cases, group health benefits and other benefit costs related to that individual and state unemployment tax elements. That's subject to change, particularly with respect to the forgiveness piece. That's where most people are interested in this program due to its characteristics of being a loan that becomes forgivable. We'll get to that in a little more detail, as that's where we're getting most of the questions at this point with people who have applied. The other aspect of this program, it was first come, first serve. There were $349 billion in it initially. Our understanding is that as of yesterday, all of those funds have been claimed at this point. Congress is working on an expansion, possibly tweaking some of the program. That's literally going to take an act of Congress to get to happen, and we don't know when it'll happen at this point, but it appears there will be a re-expansion. So if you haven't applied, I'd get your ducks in a row and be ready to apply as soon as that comes out again. If you have applied and been approved, then I suspect your focus is turning towards forgiveness. Next slide. So one of the key criteria here is that this is targeted at small businesses under the SBA's definition, which is actually quite a bit different from the FMLA definition of 500 employees or less, in particular with respect to aggregating other employers. They use what they call affiliated companies. And the basic idea is if there is any element of control between two companies, then they are likely going to be considered affiliated. So if you have larger companies, or if you have even fairly different companies that have similar officers or directors, they can be combined for purposes of determining if you're under the 500 threshold. There are a few other exceptions for specific industries. I'm going to go ahead and skip over those. If you want to move to the next one there, Shannon. One thing to keep in mind with respect to PPP that I think has caused a lot of trouble for people is that each of the PPP calculations are fully independent from each other. There are some overlapping references on information, but each one is different. So initially you have to determine what your eligible principal is. That's the 2.5 times your monthly average payroll from the year prior. Then you have to determine how you use that those proceeds, at least 75% of which must be used for payroll expenses. There's not really any matching to the prior year with respect to that. It's the current year has to be 75% of what you use once you get the loan that you use those proceeds against. Then there are forgiveness limitations that are different from the 500-person calculation. The 500-person calculation is just one individual. If they are part-time or anything short of a volunteer for you, they count as one for purposes of your 500-person eligibility side. But on the forgiveness side, it appears to be very different, where it focuses on your full-time equivalent employees. And then there are also wage reduction calculations that are fully different as well. The best way I can explain it to you is that each time Congress ran into a new calculation issue, they decided to start fresh rather than trying to combine them all together. So there are references that are similar, but the way they get applied is different. If you can go ahead and go to the next slide there, Shannon. So where we're getting the most questions these days is on the loan forgiveness issue. And so I want to spend a little extra time on this. Foundationally, your balance that you get on the PPP loan, you have to spend it on eligible expenses during the 8 weeks following the loan's origination. We had a few questions still on when that loan origination date is exactly. It's either the date you sign the note or the date funds are made available to you. Usually that's the same day, but a few cases we've had a little variation. So if you're running up against the end of that, you may want to hold off signing your note if they're saying funds won't be available till the next day, at least at this point. So 75%, as I mentioned, must be used for payroll costs to be forgiven. In guidance that just came out 2 days ago, it appears that the maximum amount you can use is still capped by this $100,000 annualized amount. And most people had looked at that as a $100,000 divided by 12 equals about $8,300 a month. But the SBA and Treasury came out and indicated that they're actually calculating it on the basis of 52-week year. And so their calculation of the maximum you can attribute to any one individual is $15,385 for the 8-week period. So that's going to be interesting to watch. We are expecting further guidance on this by next Friday is when it's required under the Act. They haven't hit every deadline so far, so I'm not sure it'll happen, but we're hopeful to get a little more clarity by then. The other limitations on this that we're getting a lot of questions on is there's two different forgiveness elements where you can have limitation. And the first one I call limitation, where there are two, again, different calculations that can limit how much of the eligible amount, so the amount you spent in that 8 weeks, is reduced if you either have a reduction in your number of employees, and you get to pick between two different category or timeframes to compare that with, between February 15th of 19 and June 30th of 19, or January 1st this year through the end of February of this year. You compare either one of those time periods with your full-time equivalent employees during the 8-week period you're paying it. And if the percentage is less during that 8-week period, then your amount of eligible loan forgiveness will be reduced by that percentage. So if you're down 5%, your amount of loan forgiveness will be down 5%. In addition, if your salary and wage reductions for employees that are making under $100,000 annualized, and that, who qualifies for that, if you had a high bonus point or something, is something we're really looking for more clarification on. There's some references that if in any 1 month they would hit that $100,000 annualized, they might not count. But it appears if they were under 100,000 annually, is the way I'm saying, or recommending people to be over-inclusive, that if they, even if they might have gone over the threshold, still count them at this point or expect it. But essentially, for those that are under the $100,000 threshold, if you reduce their wages in X so that they are receiving less than 75% of what they received in the last prior quarter, then the dollar amount that is below the 75% threshold will also reduce your forgiveness. However, after you do both those calculations, if you restore your full-time equivalent employee count and restore those wages for anyone who was making less than 100,000 by June 30th, then no limitation on your forgiveness amount. The full amount you paid during the 8-week period will be forgiven. That June 30th one is the one that a fair number of people are looking at as they're trying to figure out how to come back into, full operation under the work from home orders. And we don't have a lot of guidance there, quite honestly. It's some bare language. We're trying to make the best of it. They are supposed to provide more regulations that will hopefully give us a lot more detail, but it's somewhat challenging. What I'm telling people at this point is sometime in June, you're going to need to be able to demonstrate they're back at least at their prior pay amount and that your total headcount is exceeding that. So that's really the best we have at the moment. Expect further details to come. Next slide. So the other program that we've had a lot of inquiries about, particularly the $10,000 grants, are the EIDL loans. So these ones are a little more restrictive than the PPP program in that they are supposed to be tied to an economic injury. They are supposed to be a loan of last resort. The benefit compared to the PPP program is that they have a much longer repayment period. The negative is there is no forgiveness program and there's a little higher interest rate. That's the way it's presented. There's a lot, and that you could get a $10,000 grant issued within 3 days of your application. However, there's been a lot of reporting, and we've had several clients that have struggled to get either the first 10,000 or being eligible for the maximum amount of the loan. This program seems to be underfunded and seems to be way behind from all the reports we're seeing at this point. It is a good backstop, and it doesn't appear to be a lot of harm in applying for it if you are eligible. However, I wouldn't hold out hope as it's your sole and primary source of funds in the meantime until we get a better idea of what's going to be happening with it. You can go to the next one there, Shannon. So one other piece, there's a employee retention credit. Most employers should be eligible for this. It allows a credit for 50% of the wages paid to an employee up to $10,000 in a single quarter. So the maximum of this is $5,000 back to the employer to help cover those wages. It is applied against your certain employer paid taxes, but is also refundable. So while it applies against it, if you didn't have sufficient taxes over the year, you would be able to get it. There's a lot of limitations and complexity in that you have to have a significant decline in your gross receipts, as well as have actually been shut down. And then there's various gotchas on when you're eligible and then you're not eligible in the future. The other wrinkle is that if you get a PPP loan, you cannot use these credits in any way. Every time we've run the calculation, the PPP loan with forgiveness is more beneficial over the course of the year. It's possible somebody will have it. But so far, the only way I'm recommending considering these is if you're ineligible for a PPP loan because you're either too large or some other reason. You can't double dip with this or really most of the other credits on here. There's one exception on that I'll get to in a second. So the other credits we have, you kind of have to pick one with respect to each set of wages. There is one other credit that you can get to that you can do for the same employee on different wages, but that gets complicated. You can jump to the next one there, Shannon. The CARES Act also provided some benefits on student loans. The one that has made the headlines is that all interest is suspended and monthly payments for students is suspended through September 30th on all federal loans. The other one that I haven't seen nearly as much focus on is that employers are authorized to contribute a little over $5,000 towards a worker student debt through December 31st on a tax-free basis. I don't think anybody's looking at it right now, but it might be something to explore down the road. And what I am particularly curious about is whether you could use this for a PPP expense. Our initial take is probably not, but it is possible, and we're awaiting a little more guidance to hopefully clarify that within the 8-week period for most companies. If you can jump there, Shannon. There's two other programs under the FFCRA. The first one is the payroll tax deferral. If you can go to the next one there, Shannon. This allows you to defer your taxes for a 2-year period. So essentially an interest-free loan for all of your FICA taxes for the rest of 2020. You have to pay 50% of it back in 2021 and 50% by the end of 2022 at a 0% interest rate. It doesn't require any special election particularly, although my understanding is the IRS is revising the Form 941 so you can check a box indicating you are electing to do so. The biggest wrinkle for it, particularly with everybody that is using the PPP program, is that once you receive forgiveness for a PPP loan, you are no longer eligible for this deferral. We thought this meant you were ineligible entirely, but the IRS has added some guidance indicating that you can use it prior to your forgiveness. So you could pay wages on this, defer your FICA taxes up until you get forgiveness. Forgiveness is not going to happen until at least the late to end of June, and a lot of people are saying it's probably going to be several months after that. So you could get a good chunk of this year, even in that case. And this is the one area that we've seen that specifically authorizes some double dipping on benefits under these programs. You can go to the next one there, Shannon. There are also refundable payroll tax credits. These are similar to the CARES Act, but a little different in how they're calculated. They can give you a little bit more room. They are primarily used to help cover some of the paid sick leave. There's a lot of complications as to how exactly you calculate this and when it applies. You also have to keep fairly extensive documentation on these that we have some overview on the next slides, but I'm probably not going to cover just in the interest of time. The biggest element on this is that different from the payroll tax deferral, if you do get a PPP loan, you are ineligible for these as soon as you've gotten the loan. So it's not tied to forgiveness in the same way. So that one is something to bear in mind, particularly if you've not applied yet for a PPP loan and you're interested in exploring these other credits possibly before you get it. There's a few people who have looked at that, but it's a bit chancy considering the PPP program is running out of funds as there has already, and we're not sure how well it'll be further funded. So those are the primary stimulus programs related to coronavirus specifically and the response to that. We have additional slides here covering some of the documentation you're required to maintain, particularly for that FFCRA credit, and I believe also for the CARES Act credit. I think they're fairly similar requirements, but they're far more detailed of guidance of what we know you'll have to keep. We're expecting probably similar levels for PPP forgiveness, but we just don't have the regs really documenting what that'll be at this time. So I think that covers the majority of our stimulus program here. Hopefully it was stimulating. This is our coverage of our resources that we're providing. And like I said, we'll have this up on our website, so you'll be able to click on these links a little easier and get a little more details of some of the topics we've covered. At the bottom, you'll see that sample leave form. I would highlight that as a fairly unique resource that Brenda Hamilton and John Fuchs developed that I think could be really useful in documenting the employee leave elements. And I think with that, Shannon, if you want to jump back on, we can kind of start a Q&A session.
Yeah, so thanks for hanging with us, everyone. And we did get some questions that came through, so we'll be working to answer those. Just note, as we said at the beginning, this is being recorded and it's public. So there's no attorney-client privilege here. We're not going to announce the names of people who have asked questions, but if you do have employee-specific questions for us, feel free to reach out offline about your particular situation to any of us. And we're happy to answer those offline. And I show you here our contact information on this last slide. Feel free to reach out to any one of us and we're happy to address them. Okay, so for questions, we've got a couple here. One person asked, does a child need to be biological for the paid sick eligibility? And John Veering had already responded. I don't know if you guys can actually see the Q&A, but no. And you know, whether a child is your son or daughter is addressed in the Q&A, the frequently asked questions that the DOL put out. And so the child can be biological, adopted, a foster child, a stepchild, a legal ward. The answer to this question basically is addressed in the frequently asked questions 40, 66, 71, and 72 in more detail. There are circumstances also where a child over 18 would qualify, for example, if they have a disability. So if you've got a particular situation like that, feel free to look at that guidance on that as well. Someone else asked, they said they haven't had any employees ask for extended leave or sick time, and the notice has been posted. Is an employer or a business obligated to ask employees if they want to take advantage of the program, or do they have to come to you? And I'll let John, chime in with more detail, but the quick answer to that is no.
Yeah, I certainly agree with that. And I think it's just a matter of communication that you could go to employees, but you're certainly not required to. It's at your discretion.
Another question we have, should fringes apply to special sick pay? The frequently asked questions basically says for FFCRA, it's the regular rate of pay that's going to apply. And the DOL, there's actually a link on the DOL's frequently asked questions under question number 8 that takes you to their fact sheet 56A on how you calculate the regular rate. Okay. John Veering, we've got a question directed to you here. Keeping the person who may be infectious or has been around someone who was confidential makes it difficult to take preventative measures, for example, sanitation. If you don't know who you may have had contact with, you don't know where to take corrective and preventative measures, can you address this challenge?
Well, it is indeed a challenge. If you know that the person who tells you I've been exposed or I've tested positive worked on X machine, even though people may guess at it, I would say in terms of keeping your workforce safe, I would go in and clean that machine, clean that area. And if somebody asks why, well, we just think it's necessary. You don't need to say, well, Joe Blow worked here and he has COVID-19. It may be difficult to take appropriate measures, and you have to sort of balance the duty to maintain a safe workforce and a safe place of work with the obligation to keep it confidential. And some employers may say, I'm more afraid of my employees getting sick with the virus than I am the potential for a claim by somebody that you disclosed I was COVID-19, and what are their damages? Did they suffer emotional distress? Did they get attorney's fees? And so there may be some employers that say, I'm willing to take that risk. Shannon, do you have any other insights or thoughts on that question?
No, I agree. I agree.
Go ahead, Shannon.
Oh yeah. Here's an interesting question also. What happens if a business gets the PPP loan and they tell their employees that they're now going to be on the payroll, but the employees want to stay on unemployment?
Well, it seems to me that the answer is you're only entitled to unemployment if there's no work for you, and you have to, even under COVID-19 circumstances, be ready and willing to come back to work when there is work available. So it's not the employee's option. Well, I'd rather sit at home and go fishing or spend time with my kids and get $600 a week. If there's work available, from the company, you're not entitled to unemployment, and the person either reports back or the employer can protest that unemployment because there is work available.
Yeah, I would add to that we've had a number of inquiries relative to how, I think we have a bit of a follow-up question on this one, that so for instance, like a restaurant where they're closed and they don't have a need for their full workforce, but now they have the PPP loan and they're trying to balance, how to do that. My understanding is along the same lines of what John said, that if you're offering them employment, they would no longer be eligible to receive unemployment compensation. But there are some wrinkles where people are debating whether to offer them compensation, even though they don't really have work available, that I think is going to lead to some interesting challenges if the employee is resisting it there. Most companies at this point seem to be taking a tact of waiting on that, allowing the employee to stay on unemployment if they see it as a materially better total compensation, and possibly offering additional compensation when they return to try and maximize more of the PPP loan. That hasn't been expressly blessed at this point in the PPP regulations of whether you can offer those one-time bonuses, but I know a fair number of companies are considering that when their 8-week period has already started, but they're not ready to return to work.
John, I think you've got a question about what was the number that will be used for folks that make over $100,000. Could you address that?
Yeah, so we had thought it was going to be about $8,300 a month, a little more than that, 100,000 divided by 12. The number that came out was 15,385 for the 8-week period. So to the extent you're relying on forgiveness, I believe that's the number that's going to be applicable as the maximum you can do per individual with respect to their wages. We still have some outstanding questions related to commissions and such there, as well as it appears benefits are generally available, but some of the guidance has been less than clear, particularly with respect to owners and their benefits. We got a few random parentheticals that have left us with more questions than answers, unfortunately. But the short version is that number at this point appears to be 15,385 for the forgiveness calculation.
Another person asked about, I mentioned earlier that the first 2 weeks of the expanded family and medical leave is unpaid. And so they were asking for, when does that 2 weeks apply? And that applies to reason number 5, when the employee is unable to work or telework because they're caring for a child whose school or place of care is closed. And basically, the first 2 weeks of that are unpaid. They can use unpaid sick leave for the first 2 weeks, or accrued paid time off under their benefits package if that's available. So that would bring to a total of no more than $12,000 in the aggregate that could be paid when combined with the 2 weeks of paid sick leave plus the 10 weeks they're entitled to later. So hopefully that clarifies that. That goes with the child care.
I might mention that under this expanded FMLA leave, it's 12 weeks total for the year. So if someone has been out for 6 weeks on their own personal health condition, they don't get another 12 weeks. They just get an additional 6 weeks. And so you have to analyze it on an individual situation. And to follow up on what Shannon said, expanded family and medical leave is one thing, and separate from that is paid sick leave. And Shannon, can't you get the first 2 weeks of paid sick leave, even if it's because your child is now without school and you have to take care of the child?
That's right.
Looks like we've got another question kind of related to the timing of the PPP loan. In the example, business has been closed, is non-essential. They applied and were approved, and they got their promissory notes today. They're asking if they can delay getting the funds and starting that 8-week clock. The SBA has indicated that the maximum they'll allow anybody to delay between when the SBA approves it and when the fund or the loan is originated and you actually get the funds is 10 calendar days. So at 1 week, there's probably not a lot of time left if you were fully approved a week ago. If it's longer, there's a lot of other complications there that we're looking for additional clarification, but the 10 calendar day one seems to be a hard cap from that SBA approval.
Let's see, I think we may have now covered all of our questions. Just double checking here to make sure we didn't leave anybody out.
I would also like to add at this point that we have beyond the three of us, there are a large number of the attorneys in our firm that are advising clients on various aspects of this. So feel free to contact your regular Siegfried Bingham client contact. And if they don't know the answer, they'll get with one of the attorneys that's specializing in that particular aspect of this, and we can get you an answer. And the answer might be different next week than it would be if you ask us today.
Right.
Different this afternoon, the way this is moving.
Yeah, we have our contact information here, but like John said, feel free to reach out to any, your normal contact at the firm. Anybody's happy to help you. And one of the last resources listed on this page is our COVID-19 page on our website. We have a lot of guidance there for you that addresses a lot of kind of the frequently asked questions. The local orders are posted there as well. And as well as that employee leave form that John and Brenda developed. So feel free to visit our website, give us a call, shoot us an email. We're happy to help. These are really difficult times and things are changing quickly. So feel free to reach out.
Good.
All right, well, I don't see any more questions. So thank you everyone for your time. I really appreciate that you joined us here today. And I think with that, I think we're done unless you gentlemen have anything else.
I think the recording will be on our website or otherwise posted. So if you want to listen to it again, or there's a colleague in your organization that you think would find it beneficial, that's a resource we're making available to our clients.
All right, thank you everyone so much for being here, and hope we talk to you soon. Take care.
Stay safe.